My name is Lynleigh Evans. I'm a Senior Medical Advisor in Western Sydney Local Health District. And I should say this project has been done in partnership with the University of Sydney Faculty of Engineering and IT, and also that we've had a Cancer Institute Innovation Grant to assist with it. The background is the multidisciplinary teams are now considered the gold standard of care for cancer patients. But we all know that performance of multidisciplinary teams varies, both in how they function and the role they play in decision making. Validated tools do exist to measure the performance of multidisciplinary teams, but they tend to be observational and they're resource intensive and can be expensive. So no simple, easy-to-use validated tool exists to assess multidisciplinary teams and to support them in improving their performance over time. So that was our aim. It was to develop a valid and reliable maturity matrix as a self-assessment tool for MDTs to evaluate their maturity and to monitor their performance over time. So this actually started in late 2016 when we had an MDT workshop. We undertook a member survey and we did a literature review, and we incorporated all these findings into a two-dimensional matrix model. Now this model had 5 components with 4 subcomponents and 5 levels of maturity or performance, so that in total there were 100 boxes, and each box contained or could contain several criteria. So there were in total 200 criteria. This was introduced to the MDTs at Westmead in 2017, but it was a Word document. And while the feedback was positive and teams scored between 21 and 93 out of 200, there was a clear message that it needed to be simplified and needed to be easier to complete and digitised in some way. So since then, we've been validating this model using the Delphi methodology to refine the content and structure of the model. And we've had reviews by many groups and also used a card sorting technique whereby participants move each criteria into the box that they feel is most appropriate. We've had 4 iterations and a total of 30 participants were conducted to reach consensus on the indicators and maturity levels. So we're now in phase 3 where we're developing or transforming this into an online instrument. We had hoped that this would have been completed and we'd have some early results, but unfortunately there have been some unexpected delays. So hopefully in the next few weeks, we'll pilot this model with some multidisciplinary teams, and then we'll analyse it for reliability and validity of the model. If this is successful, we'll disseminate it more widely. And you can see the picture on the left shows that we should say that the components were refined. The picture on the left shows that there are now 6 components: governance and leadership, clinical discussion and decision making, meeting organisation, patients and GPs, data analysis and research, and infrastructure and workforce. So there are a total of 17 subcomponents, or what we're now calling indicators, and we've kept with the 5 levels of maturity. So this next slide, this shows just one example. Instead of having dot points for criteria, we've now changed it to a picture of what the MDT would look like at that level of maturity. And the team members will be asked to say what they think best fits their MDT, either with radio buttons or with a moving scale. So the results is that consensus was quickly reached for the indicators with good internal consistency, and the maturity levels required additional input from a Delphi sub-panel. The final maturity matrix consists of 17 indicators across 5 maturity levels, with a total of 85 items. So we feel that this tool has the potential to be very useful for cancer teams to identify their strengths and weaknesses, and also to monitor their performance over time. Validity and reliability of the model will be assessed over the next month to 6 weeks when the online instrument is piloted. And while this was not a specific equity project, it will enhance equity by ensuring that the standards of all MDTs are comparable and they're not wholly dependent on the quality of the chair or other variables. And outcomes for all should improve as MDTs mature across the board. But I should also add that having listened to the talks this morning, I wonder if we should actually include a specific indicator for equity and have 5 maturity levels for a multidisciplinary team relating specifically to equity. Thank you.
Do we have some questions for Lynleigh? I'm just wondering, Lynleigh, at Western Sydney you obviously have a vast number of multidisciplinary teams in comparison with a rural area like we are. Have you had good engagement with the different teams, or is it that you've only engaged with a small number of teams?
This is linked with a tumour program strengthening initiative we've run in Western Sydney, and it's closely aligned. We have an annual MDT survey for members. We had 12 teams agree to participate in this project, and really all our teams except the breast ones, which are run through the Breast Cancer Institute. And in terms of completing the survey, we had 129 in the first year, 118 in the second year, and this year we actually had 140 people complete the survey. So we haven't repeated this, but we think we've got good engagement.
Thank you. Well done. Thank you.